Can a chiropractor heal your scoliosis? Chiropractic is a branch of medicine that focuses on diagnosis and treatment of joints of the body. Now, normally chiropractic focuses on the spine, being its number one point, and what it's looking for is spinal conditions or spinal misalignments that can affect different tissues or different systems of the body, which can lead to symptoms. But more importantly, what they're interested in is the spine affecting the nerve in a negative way. And if it affects the nerves in a negative way, it can lead to a host of multiple conditions and malfunctions within the body. So as chiropractors treat the spine with either adjustments or manipulations or through therapies, exercises, or tractions, they're trying to remove this pressure so the body can reorganize itself and function at a higher level. We know chiropractors treat approximately 35 million adults and children yearly in the United States. So the question is, with chiropractors focusing on the spine, focusing on alignment, focusing on nerve pressure, can chiropractors cure or heal scoliosis? Well, first of all, we know scoliosis is a condition that's non-curable. You can't cure scoliosis, you can't heal scoliosis because scoliosis is idiopathic in the majority of cases, meaning we don't know what caused it. So since we don't know what causes scoliosis, we can't claim to cure it. However, we also know scoliosis is also progressive, means it worsens over time, and it can worsen in two main types. It can worsen during growth, and it can worsen in late stage life as curve progresses as a result of compression over time. So even though we know scoliosis is progressive and we know it's uncurable, we also know that scoliosis can be highly treatable, meaning you can slow down or stop the progression, you can reverse some of the progression and make the curve smaller, but you have to do it in a very diligent way and a very comprehensive way to get the best results possible. There are two main approaches or methods when it looks at treating scoliosis. Something that I call traditional treatment options versus conservative treatment options. Now, traditional options has its own conservative approaches, but they're different than the conservative approaches that I'll be talking about. Now, we can also look at this as surgical approaches or non-surgical approaches. In the United States, mostly scoliosis is treated by surgical doctors or orthopedic surgeons, and typically orthopedic surgeons have their own non-surgical or conservative approaches under that branch. However, we want to talk about other non-surgical approaches that we can look at in terms of treating scoliosis. For those wanting to not go through surgery and not have a surgical recommendation, and people who are just watching and waiting to see what happens to their scoliosis, there are less invasive forms of treatments that patients can choose in order to try to stop the curve from progressing. And typically a chiropractic-centered approach provides an effective treatment alternative. But when I talk about chiropractic-centered treatment approaches for scoliosis, I'm not saying it's limited to just traditional chiropractic care, meaning traditional adjustments for spinal misalignments, trying to take nerve pressure off so the body can heal better. We want to look at a comprehensive program. So when we look at chiropractors that actually treat or manage scoliosis, we know any chiropractor can take care of a patient that has scoliosis, meaning if you have scoliosis, and you're feeling pain or dysfunction, you can go to a chiropractor and receive a chiropractic adjustment. But it doesn't necessarily mean that the patient or the doctor is actually treating the scoliosis to try to get a reduction. They're more like treating your symptoms of your scoliosis than trying to treat the scoliosis, because scoliosis is a complex three-dimensional spine that is literally beyond the scope of just general chiropractic adjustments. You need to find a chiropractor who focuses on scoliosis, because they need to know how the spine has misaligned with that scoliosis and how to treat not only whatever misalignments that a chiropractor would normally deal with, but how to deal with all the effects that the scoliosis is having in the body. Treating the scoliosis proactively in this approach is what delivers a positive outcome. While general chiropractic care can be normally used to help keep general spines strong and flexible and in better alignment, in scoliosis-specific cases, normally we're using more than just chiropractic care, like I mentioned. We're using many other treatment disciplines that will be applied correctly in the pattern of the scoliosis to provide the best possible outcome. Now, chiropractic-centered scoliosis treatment definitely involves chiropractic adjustments, but it can involve other things, like something I like to call specific scoliosis rehabilitation and therapy. Specific scoliosis rehabilitation and therapy are normally passive therapies that are done to the scoliosis to help realign and push the spine into a straighter alignment, help improve spinal flexibility in the areas of the scoliosis that have gotten stiff, and it really help with derotation of the spine. Normally, this includes many different things like traction, vibration, neuromuscular education, scoliosis-specific rehabilitation, scoliosis-specific exercises, and so forth. Chiropractic techniques like manual adjustments or instrument adjustments can also be used to help realign the spine, but normally ones that focus on scoliosis are structurally based adjustments, meaning they're more interested in than just trying to improve ranging of motion or just trying to reduce pain. They're physically trying to help realign the spine into a straighter position. Once all these two things are performed, the second thing to consider is the dose of treatment, because most of the time, traditional chiropractic or traditional therapy is done very long over a very long dose, with very short dose of treatment over a very long duration. So it's a little bit of treatment over a very long time. Traditional, where scoliosis-specific chiropractic approaches are normally high-dose treatments that are done over a very short time. So the dose of the treatment is very, very different as well. Typically, it's when we start to see structural changes within the spine in terms of curve reduction. Now we can start focusing on other types of things like strength. These strength-based techniques can be sometimes considered physical therapy, but they're not physical therapy just trying to increase core strength or ab strength or back strength, because typically scoliosis patients don't have a strength issue. What they have is something called a leverage issue. Because the spine is out of alignment, the muscles have lost their leverage to help support the spine properly. It's not necessarily they're weak, they just lost leverage. So therefore, we have to give very specific scoliosis-specific exercises to help rebalance the spine so the muscle can start gaining the proper leverage they need. So just muscle strength exercises aren't necessarily effective. They must be specific, designed for the patient's scoliosis. And last thing we consider is something called corrective bracing. Now, corrective bracing is normally something that's done to help move the spine into a straighter position. It's very different than traditional conservative bracing. Traditional conservative bracing is only used during a growth phase to try to slow down progression. It's a squeezing style brace to try to slow down progression during growth, where corrective bracing is actually pushing on the scoliosis in the body to help improve the shape of the torso and the body as a result of the treatment. So this type of bracing is very, very different than traditional types of conservative bracing. And the last thing is home therapy. Now, we know home therapy provides a very critical portion towards long-term results and stabilization, but the home therapy must be very specific. It's not just general exercises or going to the gym and doing a bunch of sit-ups. There are very specific scoliosis exercises. So we take all the pieces that we use in the office treatment and the corrective bracing, and then we design a abbreviated form for patients to continue to use this at home. So you can see that this program is very, very different than just going into a chiropractor and getting adjustment and going on your way, even though those things can help many, many patients. But for scoliosis patients, they need a tremendous amount of more work. Like I mentioned, this type of conservative treatment is designed to reduce the curve. So at this point, we are managing a scoliosis reduction over time. Now, traditional conservative treatment definitely can have its own place, but it's not as comprehensive. Traditional conservative treatment, typically the only treatment they offer outside of spinal fusion or watch and waiting is traditional bracing, which has a squeezing style, like I mentioned, that's only recommended during growth times. If the patient is no longer rapidly growing, or they're an adult, or they're pre-growth, they may not recommend bracing at all, because the only goal of these braces are to slow down progression during growth. If the curve were to progress beyond bracing standards or progress into the severe category of 40 degrees or greater, this is when they start considering spinal surgery. And spinal surgery is something called spinal fusion, where they use rods and screws in the spine to fuse the spine to try to straighten it. So they sacrifice function and movement of the spine for alignment. So spinal fusion itself is a non-functional approach. The conservative chiropractic-centered treatment approach wants to preserve spinal function while reducing the curve. So we're trying to get both things to occur, not sacrificing function versus alignment. So when we look at what type of alternatives exist for patients that have scoliosis, we definitely know a general chiropractor can help patients that have scoliosis, and they can treat patients that have scoliosis, but normally they're just treating the symptoms associated with their curve, meaning if they're experiencing pain or discomfort as a result of the scoliosis. If your goals are curve reduction, you're trying to reduce the size of your scoliosis, improve the shape of your torso, improve the shape of your body, and reduce the curve size, we know a specific chiropractor that focuses on scoliosis-specific type of care is more appropriate. Here at Scoliosis Reduction Center, we act proactively using a chiropractic-centered approach to try to reduce scoliosis in a very effective manner by combining all those therapies that I mentioned and coordinate them in a very specific way with this high-dose, short-duration treatment followed with the appropriate home therapy, home rehab, and bracing, and proper reevaluations. We're very effective at reducing curves and stabilizing them, but it does require a very deliberate effort to try to get this reduction to stabilize and hold and to have a positive outcome on the patient's life and well-being. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.